So Heidi, your organization recently did a survey. Can you tell us about what were the main results and what surprised you about them?
Sure. This was a survey of 735 parents across Canada. And although we know ADHD can cause a lot of stress in a family, and that showed up in the survey quite well, what we found even sort of more surprising to me than I expected was the level of stress that the stigma and misunderstandings about ADHD causes to parents and a family. Some of the stories were very compelling, heart-wrenching, where they talked about people judging their children, judging how they chose the treatment for their children, different strategies they chose, the misunderstandings and lack of education for educators was very, very stressful. The stories around that were really heart-wrenching as well when they told about stories of their children being ostracized. There was one story of a child where the teacher asked him to stand in front of the class to declare he had ADHD, and the parent felt that this influenced how that child was treated for the entire school year by his classmates.
Wow. So, I mean, obviously a large topic with a lot of components. You've got the parents, you've got the education system, teachers, etc. As a mother of 3 children who had ADHD, what worked for you?
Oh, wow. All 3 of my boys portrayed differently, which actually goes to the message that ADHD is not what we call a consistent disorder. These kids don't come out of cookie cutters. They all display differently, and that's why it can be a challenge to assess and diagnose, and why a lot of kids are still being missed. And my kids actually were not, 2 of them were not diagnosed until their teen years, which caused a lot of stress. So I'd say one of the biggest messages to parents is that if you have concerns, if you think this might be an issue, get to an expert in ADHD to a full, proper assessment, because one of the biggest things is knowing what's going on and getting a psychoeducational assessment if you can, which also will give you a fuller picture if there's additional learning disorders impacting the child's learning. And when you see a physician, he'll also assess for things like anxiety, depression, other things that can frequently come with ADHD, especially the inattentive profile. So I think that was the biggest factor with my children. Looking back, I mean, my kids are now 27, 31, and 34. So, and, you know, we've got 2 grandchildren. Looking back, things would have been much, much less stressful as a family had we known much earlier. The other thing I'd strongly suggest is once the diagnosis is made, parents educate themselves. I think that also makes the largest impact on a family.
Because how young can this manifest itself in a child?
Oh, there's lots of stories where parents say they knew in the womb that the child was so much more active, as infants, slept less, much more active as toddlers. But of course, that is the kids that are more on the extreme level of symptoms. You know, there are a lot of kids that we miss with this disorder who don't have the hyperactivity and impulsivity, and that is a myth. A lot of people only picture kids with ADHD as being hyperactive little boys. That's not true. We know we're missing what we call the primarily inattentive males. This used to be called ADD. Now the proper name is ADHD, primarily inattentive. But also the girls, and in the majority of the cases, the girls are the primarily inattentive type of ADHD. And these are the kids who are quiet, daydreaming at the back of the class, not disruptive, but we know their difficulty with regulating their attention hugely impacts their learning. And a lot of these kids we don't pick up till later in life. And when we don't pick them up and they've been dealing with undiagnosed ADHD, that's when we get anxiety and depression in the picture as well.
So what are some red flags for parents then? I mean, we're all busy. We try to be on top of what our children are doing, activities, et cetera, but what are some, telltale signs that maybe this needs to be evaluated further, that we can look at for in our own homes?
Yeah, certainly. A lot of times the first signals come from the school. I know with my own son, I was just used to his level of hyperactivity for my oldest. For him, I just assumed it was normal. He didn't have a whole lot of issues at home, but then starting school, this is where I started getting reports of, in nursery school, it was, he's only dealing with what they call the large motor activities. He was having trouble with fine motor activities. He was a little more, withdrawn for the kids. Some of the reports could be that they're just so hyperactive, they can't keep them focused on a task. You may get reports of them not completing schoolwork, not understanding instructions. The child may frequently come home without their books, not knowing what their homework assignments are, not knowing what due dates are. There may be reports of them being ostracized in the school playground. They may be complaining that they don't have friends. They're being bullied. So there's an awful lot of red flags. As parents in the home, things that you may notice is when you tell them to go upstairs and brush your teeth and get ready for school, you'll go up 10 minutes later and they're sitting on their bedroom floor playing with their toys because they've gone up, forgot what they needed to do, and they've been distracted. There's a lot of subtle clues to parents, but the interesting thing is very often parents miss them because we become very adept as parents, as Ross Green, who's a famous psychologist in the U.S., says, we become the child's surrogate frontal lobe. So we know that if we don't get the books into the backpack and at the front door the evening before, the chances are that we're going to have to drive back home to get the backpack and get it back to school are pretty good. So we train ourselves more than train the child. And a lot of times when you talk to parents, they say, no, there's no problem. But when you actually sit down and talk to them about how they're compensating or how the family is running, then you get a clearer picture of what's going on.
Is medication always the answer for treating ADHD?
No. Treatment always should be what we call multimodal. So there should be different treatments going on at the same time. As I said, the most important thing once a diagnosis is made is the education of the parent or caregiver, the people around the child, notifying the school, getting the school on board, doing classroom accommodations. And of course, that's a huge struggle in some of the provinces in Canada, getting that in place. And even when you do get the recognition in place, actually getting the accommodations and strategies implemented on a daily basis, it's a constant struggle. But, medication, in all the research that we've done over the past 50, 60 years, it's still showing that it is the one thing that makes a difference in the child's attention regulation. So what the problem is with these kids is they have great difficulty keeping their attention on track during the school day, not being disrupted, staying focused, not daydreaming. And we find that the more years they go on in school, the larger gaps they have in their learning. while there's strategies you can put in place in the classroom, things like that, the teacher subtly reminding, redirecting the child, a lot of the time, if a child is not paying attention, the teacher won't know. The child can be looking directly at the teacher. Teacher thinks they're totally focused, and the child's mind is in Hawaii. Seriously, they're just not there or with it. Unfortunately, one of the ways to deal with this is one-to-one instruction. Who can afford that? Or, that's just not realistic. So, treatment should always look at the whole child, look at their strengths, look at their weaknesses. And most parents I've spoken to, probably in the last 20 years, I've spoken to tens of thousands of parents individually and as groups. None of them want to put their kids on medication. I've never met a parent who's gung-ho and says, yes, this is the thing I want to do. They usually try all other strategies and, techniques before, behavioral management techniques and directing and all kinds of things. But at a certain point, they realize that the child is just struggling and not being successful at school and getting further and further behind. And that's usually when parents make the decision. And it's a hard decision. It's very difficult for parents. That's why I get very frustrated with people who are judging these parents when they've already gone through this horrendous, decision and hours and hours and hours of research and educating themselves.
Finally, Heidi, as somebody who has tackled this issue and been sort of on the front lines of it from so many different perspectives, as a mother, as an educator yourself, as somebody trying to continue to draw awareness to the issues surrounding ADHD, what in your ideal world should educators and teachers be doing to not only support the students but to support the parents?
Wow. Great question. I think including the parents in as one of the team is the first step. Respecting that the parents, have spent a lot of hours with these kids and probably have some great tips they can share with the teacher of things that have worked and not worked for their child. I think the other thing is educating themselves about the disorder. I think, this is something I don't want to blame educators for, because there should be a lot more education while they're being trained. I mean, I do go and train special education teachers while they're being trained as special education teachers, and they really have very little knowledge of this. They're just not trained as regular teachers in this. The school board should be giving training during their TA day, their, what do they call it, EA days, special education days, training. So, that's not a teacher's fault, but the more a teacher can do to train themselves, and the better. We're actually having a conference in mid-October where one whole day is geared to educators, and we've got world-renowned experts coming in. So, taking advantage of those kind of days would be great. Schools allowing teachers to take off for those days. But then I'd say the third thing, and sometimes the most important, is the goodwill of the teacher. Because, we know a lot can be done in a regular classroom for these kids. And very often it's small things like setting up a homework buddy for a child, or, just communication with the parent. Checking if the child has understood the instructions or the questions. And some of these strategies can be set up, with another student, or things that really don't cause a whole lot of time throughout the year for the teacher, but they need to be set up at the beginning of the year.